My name is Letwin Chanakira. I'm from the SAFAID Zimbabwe Country Office, Program Manager. On behalf of SAFAID, the Regional SRHR Youth Advocacy and Accountability Alliance, and the People's Matrix Association, let me take this opportunity to welcome you all to this youth special session. Young people make up the highest majority of the population and should be at the forefront of advocacy efforts, hence the importance of this session titled Pockets in the 2030 Agenda, Empowering Youth Advocacy for SRHR Through Digital Innovation. So this session will serve as a platform to share perspectives on strengthening youth-centric, digi-health advocacy as youth-centered and health system strengthening modalities to improve public resource management and SRH service provision for adolescents and young people through youth-led advocacy. This session will enable us to further deliberate on the ICASA 2023 theme. We would like to thank Sweden for their generous support to the regional SAFAID's Transforming Lives SHARP program being implemented in 16 SADC countries. So this special youth session is under this program. I welcome Takuzo Shoko to share his presentation on social accountability monitoring for SRHR and the Mobi SAFAID's application. Takuzo is a regional program officer with SAFAID based here in Zimbabwe. Takuzo advocates to improve social accountability initiatives amongst rights holders to ensure duty bearers remain obligated to their mandates on SRH service delivery. Over to you, Takuzo. Logistics, can you kindly share the presentation?
Good morning, everyone. How are you all doing today? Great, great. My name is Takuzo Shoko, and I will be presenting on an example of an effective digi-informed youth advocacy initiatives. So I'll be speaking towards the same for SRHR model and the Mobi SAFAID application. So for starters, I think as we are waiting for the presentation to be beamed up, I'll just introduce you to SAFAID. Who is SAFAID? What is SAFAID? So SAFAID is a regional, it's a regional indigenous African youth organ. It's a regional indigenous African CSO that is that operates in SADC, in the SADC region, and it's based in the in Harare. Its regional office is based in Harare. And we are operating in 6 SADC countries, that is Eswatini, Malawi, Lesotho, South Africa, Zimbabwe, and Zambia. So SAFAID usually focuses on adolescents and young people, and with particular interest on adolescent girls and young women. So can you move to the next slide? Next slide, please. So SAFAID contributes to the SRHR to ending SRHR injustices within the SADC region. And as you can see, its focus is on 7 key SRHR issues. But these are addressed through amplifying gender equality and social inclusion, while strengthening feminist principles, gender equality, and SOGI SC. We also empower we also strengthen in empowerment for resilience within adolescents and young people by strengthening the links with SRHR and climate action, as well as cybersecurity within the African context, as well as strengthening mental health and psychosocial support. Next slide, please. So, what is the SEM for SRHR model? This is a health strengthening model that seeks to improve SRH service provision for adolescents and young people. It empowers young people and as social assets and generates a movement of SEM for SRHR youth champions who are capacitated in enter policy advocacy spaces that they interact with the rights holders and duty bearers. It also enables, it increases the demand for and access to SRH services for adolescents and young people, and it brings to awareness the need that young people have for reaching these SRH services. It also introduces us to the MobiSurface application, which provides real-time data, which allows for adolescents and young people to raise their advocacy issues. And it also strengthens the partnership between young people and duty bearers. Next slide, please. So this is the diagram. This is the introduction of the SEM for SRHR model. This is how it looks. So we have our three pillars: the components, the advocacy, actions, and the transformation. So you find that there's initially a baseline where you identify and you map the adolescents and young people, and as well as the youth-led CSOs that you'll be working on. And then the components include the capacity strengthening and trainings that will take place for the SEM for SRHR and public resource management. This also involves the setting up of the MobiSurface application and social mobilization, which then leads to the creation of a SEM for SRHR site. This is at a health facility. So from these health facilities where we create advocacy actions, young people come together and they meet at the youth-friendly centers and they caucus with duty bearers. They conduct scorecards. They also get issues from this MobiSurface application. These will be issues that will be raised as advocacy issues. So these could be SRH service provision issues. So this would lead to transformation after they've engaged with the duty bearers. It leads to transformation, increasing of adolescents' access to services. It also reduces service access barriers and so forth. So on to the next slide. So an introduction of the MobiSurface application. This is a digital health tool which is rights-based and it's Afrocentric. So, and it's gender responsive, so it catalyzes digital youth citizenry. It involves youth so that they take up the application. It also makes use of social accountability monitoring as a tool and in generating data, real-time data that will inform advocacy actions. So it is particularly unique in that it has a two-way communication, which improves the connection between adolescents and young people and their service providers. It also provides a defined pathway for adolescents to interact with the service providers, as well as helps to track the progress of the issues that have been raised at the health facility. On to the next slide, please. So these are just the process steps for the application, where the young person creates an account and they raise their ticket, their SRH service issue, and they report, and then this application sends a notification to the sister in charge. And then the sister in charge address the issue, which is on step 3. He or she assign this ticket to the relevant person, that is to the relevant service provider that can address this SRH service issue. And when this issue has been addressed through youth-led actions and caucuses with the young people, the service provider marks the ticket as resolved. But if the young person's service has not been reached, the young person can go back into the application and mark it as unresolved because their service has not been reached, has not been addressed. And this then takes us back to step 3. That is why it is in red. And from step 3, this will then help the site focal person to address this issue as needed. On to the next, please. So you find that the MobiSurface application is aligned to national ICT policies within the countries that we operate in, within the SADC region. It also responds to the WHO global strategy on digital health, and it adheres to global digital health principles, accessibility, interoperability, scalability, transparency, privacy, security, confidentiality, and data integrity. It also provides an efficient way for district and national level structures in addressing and mapping whether they are reaching their national strategies and national targets as well. On to the next, please. So what has changed from the onset? So you find that since SurFades has through the same for SRHR model, we have reached plus 127,000 young people. We've realized at least an increase on social accountability monitoring knowledge, an increase from 40% to 87%, and self-efficacy increased by 40%, and as well as safe abortion knowledge has also increased by 77%. As far as the MobiSurface application is concerned, we've managed to register at least 30,000 plus young people. And of the 5,000 tickets that were raised, at least 62 were resolved, and this was through the same for SRHR Youth Champions agency within the communities. Yes, the next slide, please. So these are the results that we've achieved, and within these countries, you see that there's been a lack of youth-friendly centers. There's been a lack of access to commodities. Young people have been facing issues of stigma when they reach when they get to the service providers. But we've managed through Ministry of Health agency. They have managed to speak to address these issues and provision of youth-friendly centers. Next slide, please. So this is just some anecdotes from the youth champions, where you find that most of them have been testifying that confidence has been increasing since they have becoming youth champions, and they've shown their agency, and they are now confident because of the influence of the MobiSurface as well as interaction with the same for SRHR model. So I thank you. Over to you, Letwin.
Thank you, Takudzwa, for clearly explaining how young people can engage and utilize the same for SRHR and technology in driving transformative change, shaping policies, and influencing practices within the region. And indeed, regional SRHR advocacy through social accountability monitoring actions is crucial in addressing inequalities and accelerating innovations and inclusion. Our second discussant is Tato Tinyane, who is going to present on the impact of SEM for SRHR by young people in the SADC region. Tato is a member of the regional SRHR, the advocacy officer and project coordinator with the People's Matrix Association, a leading LGBTIQ+ organization in Lesotho, and the lead coordinator for the Southern Africa LBQ network. She's a Pan-Africanist and queer womanist thinker, organizer, and campaigner based in the Kingdom of Lesotho. Tato's pronouns are she and they. Welcome, Tato.
Good morning, everyone. I want to start us off, to get some energy in the room, and referencing on, ICASA's theme that is AIDS is not over, and the World AIDS Day that said, let communities lead. I just want to start us off with a chant and to repeat after me, let communities lead. Let communities lead. And also, let youth lead. Let youth lead. Thank you very much. Like it has been said by the moderator, my name is Tato Tinyani. I come with the People's Matrix, which is based in Lesotho, and here with the regional SAFEDZIA. And so what I will be speaking to is connecting the dots, between youth organizing when we talk about the various issues that youth are organizing for, and how do we sustain and strengthen that connective and collective youth movement and advocacy, and how do we sustain the movement and our agency. Next slide, please. So I'm going to be talking to the young people in the room and those that work with young people. Often it is said that young people are troublesome, young people are disruptive, young people are not competent enough. And these are the reasons why we are not being trusted to lead our own issues. And so ours as young people in our advocacy, in our organizing, is to break the fallacy, to break the rhetoric that we are not enough for ourselves to lead for ourselves and solve our own issues. And also to break the fallacy that young people are the same and are an homogeneous population or community. Young people are diverse in various different ways. They are leaders in their communities, they are churchgoers, they are believers, they are scientists, they are farmers, they are nurses, they are educators, right? Young people also come from different backgrounds. Some come from poor backgrounds, some come from well-off backgrounds. Some are people living with HIV, some are those living with rare diseases, and some are, queer and gender diverse. And this is the nature of the demographic. When we talk about harnessing the youth demographic, we are looking at a vast array of young people who are competent, who are knowledgeable in their different contexts, in the different circumstances that they live in. And so they are the ones who are able to speak on the issues that they organize for. Next slide, please. And so in that fashion, or in that spirit, I want just for us to take a snapshot into what young people are doing across the African continent. We've already heard from Taku what the work has been with the SRHR model in the Southern African region. And so just a quick snapshot, we've seen that when you look at East Africa, for example, young people are organizing steadfastly using digital methods when it comes to SRHR services. In Tanzania, for example, the user methods, because of some of the context is not friendly, they use methods of WhatsApp to coordinate how to get services to each other. We can look at in the Northern African region, where in Egypt, Libya, and Algeria, young people are organizing for climate and SRHR justice, and we've seen a digital revolution happening in those countries. Down when we go to West Africa, we've seen, particularly in Togo and Nigeria, a very strong upcoming movement that focuses on SRHR organizing and also against issues like female genital mutation. And this is being led by young people using platforms on social media to talk about these issues, to talk about what is happening to them, and to advocate for themselves. And down also we've seen in Burundi and DRC, particularly the issues there when it comes to the environment and climate. There's a strong push by young people, because we also know that climate issues are very much related to SRHR issues, and these are issues surrounding autonomy and agency. So I think this is just an example about how, with the intersecting issues that young people are facing, we're seeing a collective movement that is happening, that is being led by young people who are responding to their issues. Next slide, please. And so for us, what it means is, again, talking to young people, we must be very cognizant and also take it very seriously what our role is as SRHR defenders. I think that might be a new word for some people today, but yes, we are here to defend sexual and reproductive health rights. And so we must understand what it is that we are stepping into, what is the role that we are undertaking for ourselves and young people, and we use this role in our understanding to take forward and strengthen this movement. And so I will speak to one, and understanding that we have to engage in social accountability and monitoring. As young people, wherever we are, in our communities, whatever platforms, we must do the work of making sure we are monitoring what is happening in our healthcare facilities, in our villages, when we see national policies being implemented, we must be knowledgeable, right? And be curious and want to say, we must get to know our members of parliament, our community leaders, our village chiefs, and say, we know that this is supposed to happen. What is the process? That is what accountability and monitoring looks like. So we must take upon that role. It looks like strengthening our capacities as young people. It's saying, when we go to conferences and we get opportunities to go to ICASA, for example, I attended a session the other day that, taught about abstract writing. Let us use those opportunities and that knowledge and share them with our peers when we get back home, or whatever platforms we're on. In that way, we're building our competences, we're building our knowledge, yet again breaking the fallacies that we don't know what we're doing as young people, right? So now we are arming ourselves with the knowledge to do the work that needs to be done. And then furthermore, what needs to happen is we need to strengthen our reporting and documenting. Documenting every single action that is happening is very important. We are engaged more so in SRHR justice, in GBV prevention and interventions, right? Document where you see injustice, document where you see violations, whether or not you're attached to an organization or affiliated. But when you come and you make a TikTok video of this is what's happening, you are documenting, you're reporting, you are telling the story of what is happening as a young people. And this is how we start to strengthen our movements and our coalition, because we're building evidence, right? Which is the next step in what is our role. We must build on the knowledge, we must curate and collect data, because this is what we use as evidence for our advocacy, right? Yet again, breaking the fallacy that we don't know what we're talking about. When we come with fact-based evidence that this is what is happening to young people in Burundi, or this is what is happening to young people in Cameroon, people are able to listen. People who are able to give the resources to what you're saying, it's very easy for them to say, I see what you're saying, let us assist you, right? So build the knowledge, use evidence-based resources, and that is how we do the advocacy. And that again ties into my last point, which is let us connect. I talked about what is happening across the African continent, and ours is to start linking to each other, not to work in silos. So it's to start building movements, build coalitions, and this is how we strengthen our agency as young people. This is how we make sure that we're moving as a collective voice. This is how we learn from each other, right? We learn from what is happening in Botswana and how that can be implemented in Malawi. We've seen what challenges are being faced in somewhere else, and that is how we apply it to our own context. And essentially, this is how we start to build resilient youth communities, communities that are able to respond to the diverse, intersecting issues that we face in our communities. This is how we're able to respond to the climate crisis. This is how we are able to empower, youth communities. And this is also very important as we think on our roles. It is very key and very important for us to be prepared to respond to the SRHR opposition that we're seeing is happening currently. We are seeing that the anti-gender and anti-rights movement is sweeping across our continent, and us taking a stand in SRHR defenders is how we combat and counter the movement that is happening. Next slide, please. And so I'm going to speak a little bit, just briefly, about what the anti-gender rights movement is. And what we understand is that it's a range of state and non-state actors who are working to undermine the universality of human rights, which really is the cornerstone principle that everyone is entitled to human rights with no exceptions. So These actors include institutions, individuals that are affiliated with various religious fundamentalisms, people with conservative ideologies, and theirs is really pushed to push an oppressive ideology that we see as harmful to our SRHR rights, amongst others. And so what we've seen is that the anti-rights movement uses the very same language of human rights that we use. So they have co-opted our language, and they've done that to mask the discriminatory ideologies. So we can see, simply next slide, how we've seen that manifest. Next slide, please. Can we have the next slide? Well, okay, so how we've seen this manifest is with the influx of anti-gender discriminatory legislature that we've seen popping up across the continent. We've seen what is happening in Uganda with the anti-homosexuality bill. We've seen what is happening in Kenya with the LGBTI refugee crisis. We've seen what is happening in Zambia, where the rhetoric or the language is used that is a non-secular stance when it comes to constitutions. So this is the movement or the trend that we're seeing across the continent and in various places. And what this calls for us is, how do we counter this opposition? So for one example that I can bring that is quite pertinent is we know in the AU system there's what is called the African Charter and what are African values. And so there is a document right now going around that's the Family Charter, and it seeks to say or to take a stand on what family values are. And what we're seeing is this is now boiling down to violate rights about agency and bodily autonomy, and who has the right to have a family and who does not. And so what we're doing, or what we can do, is countering these trends, is to say for ourselves, take a stand to say, we as young people, this is what we value, and this is how we value communities. It's to say that as Africans, we are for human rights and for seeing people who they are and for them enjoying their rights and having dignity. So that is how we move. And I was just to say, in this age of digital innovation, as young people, how are we going to take a stand in using digital innovation to counter the opposition that we're seeing is facing us? Next slide, please. And so my last point will be to speak to expanding our platforms and our advocacy. And now again, I'm talking to young people. Let's go beyond the ivory towers. To be present at the UN in Geneva is not the end all be all of our advocacy, right? We have various systems and various platforms that we should be engaging. Here on the continent, we have the AU system, right? Look to your resources, look to your networks, learn about how the AU system works. We have the African Commission on People and Human Rights. Let us use those systems. They are the ones that gave us the Maputo Protocol. This is where we found Resolution 275 that we can use. It is where we can engage with commissioners from our own countries and where we can really hone in on our advocacy. Let us look to our regional platforms. I'll make an example with the SADC region that has the SADC Parliamentary Forum, which is a forum where you can get up and close with your members of parliament, and that is where you can do your lobbying with them there. Look to the regional networks. We know right now there's the Eastern and Southern Africa SRHR and HIV network. Engage with networks and coalitions that you're finding. Learn from them, connect with them, and this is how we strengthen our advocacy as young people. Furthermore, we have in our own countries, there's various platforms to engage in. There's technical working groups that are from the Ministry of Health or the Ministry of Law or different portfolio committees, the Women's Caucus, the Youth Parliament. Let us use those spaces, those are even our closest spaces, and those are the ones where we should be really honing in, because that is our foundation when we're coming to higher level. And of course, let us never ever forget to go back to the community. Let us go back to the grassroots, because that is where our issues are stemming from. That is where we identify and we see people who are often left behind. Advocacy at that level looks like talking to your neighbor, right? Letting them know what is happening, what you're doing as a young person, and they spread the message. It looks like going to your community, what do they call them? We call them dipitso in our language. The community gatherings where your local chief is telling people on a Sunday what is happening in the community. Go to those spaces. Those are the spaces where you can be seen as a young person and your voice can be heard, in your churches, in your spaces, in the youth corners, on the football fields. That is where we should be doing our advocacy. And really, as I end off, this is where we're saying we need to build and strengthen our agency as young people, our autonomy. We need to be leading the discussions when we talk about youth advocacy and how we want to approach dealing and intervening for issues that affect the youth. Thank you very much.
Thank you, Tato, for highlighting the need to advocate for SRHR defenders that hold leaders and service providers accountable. For youth to contribute to the 2030 agenda, indeed, agency building plays a pivotal role. Our third discussant is Moses Chibamba, who's going to present on the global and regional strategies in digital health. Moses is the SAFED Zambia Country Program Officer, a passionate advocate in SRHR and gender justice. Leading the charge in SRHR programming in Zambia, Moses is a respected member of the SAFED's youth professionals, enabling him to persistently champion meaningful change through his leadership in youth programs. Welcome, Moses.
Thank you so much, Latwin. One thing many of us can agree to is that digital health is really bridging the gap in making sure that sexual reproductive health services are being accessed by young people. So with that in mind, we need to harness the power of the multi-dimension of digital health in addressing sexual reproductive health, in making sure that young people are able to access services and we're able to formulate policies and make sure that we have a healthy population. Can we move to the next slide, please? So in order for us to really harness the digital dimension to harness the power of the multi-dimension of digital health, we need to keep in mind of the guidance or the instruments that guide how digital health tools and systems should look like. So those are some of the examples that we have. For example, at global level, we have the WHO Global Strategy on Digital Health. Takudzwa actually spoke about it and how the MOBI Summit actually speaks to it. We also have the UN Digital Health Strategy and the African Union Digital Health Vision. So all these provide a basis to what or how digital health systems and tools should actually speak to. They should be able to promote data exchange, data privacy, and should be able to also provide systems that make health services become very easy. This is not going to be a very long presentation. It's going to be just a very small presentation that's going to showcase how we can really just harness the power of digital health. So can we move to the next slide? So it is critical for us to consider how we're able to use digital health to bring about youth-led response to sexual reproductive health and rights. One of the major things that we need to identify is that we need to identify youth as a demographic dividend. As we all know, Africa has a large youth population. So we need to make sure that we're able to invest in the health, education, and also the employment and the empowerment of the youth. But this just is not going to happen magically. So as youths in here, you need to take up spaces. I think we need to now do things in a very smart way and not in a very hard way. We need to start seeing youths being able to sit in government positions, seeing youths become members of parliament, so that it becomes easy for us to advocate when we have allies that are sitting in these positions. So that's one of the things that we need to consider. We also need to make sure that we're able to empower women and adolescents, keeping in mind of keeping in mind of gender equality. As we identify women and girls, we also need to look at populations that are underserved, such as girls living in the rural living in the rural areas. We also need to consider people living with disabilities. The other thing that we need to take note of is we need to start to see technology as a catalyst for economic growth. Once we start to empower youth with digital skills, we'll be able to see a tremendous change in our economies that will actually help us be able to grow our economies and also have a healthy population. Like I mentioned, the African population is mostly, the youth are the majority. So for us to be able to change and grow our economies, we need to make sure that we have a healthy population. So as we do all these things, we need to make sure that we also do not leave girls and women living in the rural areas. Technology mostly favors people or young people living within the urban areas, so we need to make sure that we also think about the underserved communities or underserved populations that are there. So can we move to the next slide? So this slide basically just gives us an opportunity for us to be able to appreciate where we've come from. If you look at ancient civilization innovations, the only technology that they could think about or that they could have was just simply a knife that they could actually do an operation. But looking from where we've come from and where we are right now, where we're able to have digital innovations, where we are able to use computers and be able to actually also use our mobile phones in the digital revolution and technology, in making sure that we're able to access services and also to be able to hold leaders accountable through platforms such as the mobile surface itself. So this actually just gives us a greater picture on how we need to appreciate, because we've been able to see the adoption of computers. Like I mentioned, we've been able to see the adoption of computers in digital health. We've actually now been able to see tailored treatments when it comes to health. We've actually also seen the inclusion of AI, and I know that a lot of people are actually scared and skeptical about artificial intelligence, but we can actually take advantage of that artificial intelligence and use it for a right purpose. And I know that it can actually save our communities greater. So, however, despite all these gains that we've made in technology, there's still so much that can be done in making sure that we address the challenges that the youth face. Can we move to the next slide? Thank you. So, towards the Agenda 2030, what is needed? So in order for us to achieve the Agenda 2030, we require a healthy population. Like I mentioned earlier, the greater proportion of our society is carried by young people. So we need to make sure that we recognize youth as a demographic dividend in our continent, and we need to make sure that we utilize and build the capacity of these youth so that they're able to take up these spaces and start to shape the world in the way that we want to see it. So some of the things that we need to make sure and ensure is that we need to ensure that innovations that are being created are youth responsive. They should consider the diverse youth. Like I mentioned, they shouldn't leave anyone behind, because they speak towards the sustainable development goals. So we need to make sure that the young people living in the rural areas are also being considered as we move with innovation. So we also need to recognize the intersectionality in designing and delivering these tools. We also need to make sure that we empower beyond digital tools. What I mean by empower beyond digital tools, we have systems such as social media platforms. We need to take advantage and use social media platforms to be able to popularize these digital tools that we have. And it's really, really sad that amongst us youths, what really trades so much for us on social media are things that do not even add value to ourselves. You discover that things such as digital health tools do not even get to trend. But if you ask people, or you ask youth if they know the ceiling challenge, they will tell you they know the ceiling challenge. I know that most of the people in here are actually wondering what is the ceiling challenge. The youth will tell you what the ceiling challenge is. It's something that's once you Google it, it's something that you not like. And young people spend so much time creating such content, forgetting that there's actually a greater purpose that they have in making sure that we're able to have communities that are able to grow, make sure that young people that do not have information are able to have the information and able to use this information in accessing services. Because we've agreed from the beginning of this presentation that young people actually face a number of challenges in accessing sexual reproductive health services. Then lastly, we need to make sure that we equip young people for youth-led advocacy. So tools such as the MobiSurface application itself provide young people with the power to hold leaders to account, and we've been able to see how this tool has been able to bring about change in various countries, being able to hold leaders to account and be able to make them formulate policies that are going to favor sexual reproductive health and rights for young people. But like in my closing, like I mentioned, this will not happen in a magic way. We need to make sure that young people are able to sit in these spaces and not ask from the window. You need to actually be able to sit at the table. We need to make sure that we actually participate in these local elections so that we can actually have a seat and we can have allies that are going to be sitting on the table that will understand the needs of young people, especially with regards to the health. Thank you.
Thank you so much, Moses, for enlightening us on the regional instruments and harnessing the power of social media and other platforms that can be utilized in empowering SRHR youth advocacy. I now open the floor for comments, clarifications, discussions, comments, or any commitments that can be made. Logistics, if you can assist with the roving mic. And as you share your contribution, kindly indicate your name, organization, and country that you're representing, and also who the question is directed to.
Thank you very much. My name is Nadu, and I'm from Ghana. I work with the Planned Parenthood Association of Ghana. I just wanted to use this opportunity to also share Ghana's experience on using digital health innovation. So my organization have two innovations. One, we have a digital contact center called ICASA, meaning let's talk in one of our popular local dialects. Now the center has the back end certified lay counselors and service providers. That is a toll-free line, meaning the organization bears the cost, and we do demand generation activities so that the numbers are out there for young people to call. And we have a pathway where we refer. We have also service delivery centers, and we have partnered with our Ghana Service, that is our government agencies to hospital. We refer for them to seek treatment services. We also have partnership with UNFPA Ghana to refer issues on SGB because they have a specialized contact center for SGBV. As part of Success for ICASA, it was used to pilot the delivery of self-care abortion services in Ghana. And we led, with the PPAG in partnership with Ghana Health Service, outlined the protocols to deliver self-care abortion services. Another innovation, and the ICASA also has a WhatsApp line. And another good thing is the software is able to queue calls and miss calls so that there's callback and nobody who calls get left behind. And the service delivery personnel, when they close from work, have the calls being routed to a mobile phone so that we're able to meet up 24 hours demand on calls coming in. We also have a RESI chat room. RESI means Reproductive Health Education and Services for Young People. It's a curriculum-based thing, and it's hosted on WhatsApp platforms, and it's tailored to language-based, and they're able to use other WhatsApp features like audio, and for age appropriateness, they are grouped into various age groups and deliver CSE or reproductive health education.
Thank you.
Then-
Maybe in the interest of time, you can just round up in the next 5 seconds.
Yes, I'm done. The last one to also share like a personal, we're using TikToks to deliver item people held unfiltered to give out information on SRHR to demystify and myth and misconception. Thank you.
Thank you very much for sharing your experience. So maybe in the interest of time, we can then network after and share the questions, or maybe I'll just allow for one question.
Thank you very much. I am Catherine from Uganda. I'm representing Joint Clinical Research Center. Mine is a question. Thank you very much for the presentation. I am a mental health clinician and my concern is about mental health. I'm wondering whether we are addressing, as part of SRHR agenda, are we addressing the mental health concerns of youth? And if so, how managing the stigma and mental health? Thank you.
Thank you for that question. Taka, maybe if you can respond in 15 seconds.
Okay, thank you for the question. I think with looking at our SAM for SRHR sites, we have youth-friendly corners, youth-friendly centers. And with these centers, there's a designated service provider who is there to facilitate engagements with youth and have group discussions and have even one-on-one consultation sessions, especially when they speak to their SRHR issues. So that alone also gives the young people an opportunity to share their concerns, an opportunity to get guidance to enable comprehensive sexual education within the health facilities.
Thank you for that response. We've heard from our young and dynamite discussants, and as we're moving towards Agenda 2030, digital innovations and agency building are crucial in ending inequalities, accelerating inclusion and innovation. So to the young people, the policymakers, the funders here present, let's invest in young people. Let's make them have the leading role. Let them lead. They can lead. Please feel free to leave your contact details with us so we can remain in touch. Wishing you a fruitful remainder in the rest of the ICASA. Thank you so much.